How to treat fever. Detailed overview. What is what? Hypothalamus controls body temperature. This rarely deviates much from the usual 37 degrees Celsius throughout the day. Anything between 36.1 and 37.2 is still considered normal. The hypothalamus is thought to be able to respond to an infection, illness, or other factor by raising the normal body temperature. How dangerous is a fever? A fever by itself is not dangerous. Hyperthermia, on the other hand, can cause dangerous rises in body temperature. Hyperthermia is a severe rise in temperature above 40 degrees Celsius. A heat stroke, the side effects of prescription or illegal drugs, or a stroke can all cause it. This is a medical emergency due to the body's loss of the ability to sweat naturally. Hyperthermia is uncommon because the majority of people only experience mild fevers. Seizures and convulsions caused by the fever. A sudden rise in body temperature frequently causes seizures and convulsions. 1 in 5 infants and young children experience febrile convulsions, making this a very common occurrence. Adults typically have a higher temperature that causes seizures. A temperature above 37.8 degrees Celsius is a fever. Taking a temperature. Obtain a digital thermometer from a pharmacy or supermarket to take your temperature. The body naturally responds to colds and coughs with fever. Specific thermometers can be used to measure temperatures orally, in the mouth, tympanically, in the ear, axillary, under the armpit, and rectally, in the bottom. There is a typical difference of half a degree Fahrenheit, 0.3 degrees Celsius, to 1 degree Fahrenheit, 0.6 degrees Celsius, between an oral temperature and an ear, tympanic, temperature. You can also determine whether someone has a fever by looking at them and feeling their forehead, back, or stomach. If they have a fever, they will typically take care of a person who has a high temperature, touch their stomach, back, or forehead, feel hotter than usual, be clammy or sweaty, have flushed skin and red cheeks. Keep in mind that the person you are taking care of might be afflicted with a disease that easily spreads. As a result, you should take extra precautions to lower your chance of getting it. It is essential to thoroughly and frequently wash your hands. Do. Give paracetamol, or ibuprofen if there are no contraindications, or ibuprofen to patients who are experiencing pain or distress. They should not be left in a draft or allowed to become cold. Be on the lookout for signs of dehydration as you give them plenty of fluids. Give them small, easy-to-digest portions of food if they want it. Additionally, this will bring down their fever and increase their sense of security. Avoiding things. A healthy and normal response to infection is fever. Therefore, when cooling your child, you should not undress them or excessively sponge them down. Some people find that applying a cooling flannel to their forehead or pulse points helps them feel better and lowers their fever. A fever should not be sweated out by wearing a lot of clothes or bedclothes. Nightgowns made of light cotton are best. Open a window to move the air around, but don't sit in a draft. Never give aspirin unless instructed otherwise by your physician. Never administer paracetamol and ibuprofen simultaneously. Ibuprofen should never be given to asthmatics.